Advocate Trinity Hospital has had the unique pleasure of serving the southeast of Chicago for over 110 years. Whatever is needed, whenever is needed, we are here for our community.
I was born in this community, and when I was a kid, this was a steel-making community.
Trinity is our hospital. I had my daughter here, and she in turn had both her children here.
Trinity has been able to keep people in this area knowing they've got an opportunity for good health care.
We provide excellent and compassionate care for over 90,000 patients per year.
Advocate Trinity Hospital's community area is 88% African American and about 10% Hispanic. This area is just a great place to work and to interact with our community residents.
There's a number of things that set Trinity apart from other community hospitals. We have taken innovative approaches towards patient safety and quality. We have specialized resources who all promote quality of care. We have very visible and engaged leaders in the hospital. And finally, but certainly not least, we have a culture of friendliness and compassion throughout the hospital. It is very much a culture of hugging. I've never been hugged more than when I come to work at Trinity.
One of the best things I think has happened for this community is the affiliation with Advocate Healthcare.
By being a part of the Advocate system, the largest healthcare system in the state of Illinois, we just have more resources than other community hospitals. We are providing state-of-the-art care in a community that very much needs our resources.
Trinity has the unique opportunity to extend its care beyond the walls of the hospital.
They go out into the communities and inform the neighborhoods about the issues of health and how to take good care of themselves.
We are here to be a part of the community, and we as a department work out in the community providing outreach services.
Trinity also has a breast cancer awareness ladies' night out. We have over 300 women that come. And we have dinner, they do raffles, and they have speakers. The doctors come out and they tell it.
I think it's important that they have these events to let the people in the neighborhoods know how to take good care of themselves.
They come to some of our block parties and they do tests for diabetes and screenings for the children.
Asthma and diabetes are two of our biggest presenting illnesses in the emergency department.
Asthma and diabetes are conditions that patients can also manage at home so that they don't have to show up in the emergency room. And that's where the community health department comes in. We try to identify any kind of barriers to care. If they have diabetes and they don't have ability to acquire the proper diet or food, then we help them find those resources. We work with them through our special program called Project Health, and that just means healing effectively after leaving the hospital. So we're working with them on the more of the prevention side.
Trinity has a very bright future as we continue to embed ourselves in the community, advance in technology, but as well growing as our community grows.
Those programs that they hold at the churches and the screenings they have at the different health fairs and different places, they're not free and they're not cheap.
Philanthropy helps support the community programs and services that otherwise would not be available.
The hospital means a lot to most people in the community.
I love this hospital. As I would tell my neighbors, before they roll you in here, why don't you go and check it out?
We've always been focused on putting the residents of Southeast Chicago first. And as we continue to grow our capabilities, we know that we're going to be able to offer the best in care and bring it right to the backyard of our community.